Hello, ladies and gentlemen. I want us to quickly have a look at the dermoscopic features of a malignant melanoma, or more commonly called a melanoma, because all melanomas are malignant. So using the word malignant melanoma is actually an unnecessary repetition of tautology. On this photo, we can see briefly a gross appearance of a melanoma. From the name melanoma, it simply means, a skin cancer that contains melanin or that is related to melanocytes, okay? A malignant proliferation of skin cells that are called melanocytes. Let's proceed. So common features that you will notice in a melanoma would be asymmetry, which means if you divide the lesion into two, you would usually not get roughly two equal halves. The borders or margins will usually be irregular, and you could see multiple, colored variations or variegated coloration. Atypical pigment network. So these are common things you look out for: irregular dots and globules, streaks and lines. You could see what we call regression, where you begin to see fibrotic, whitish tissues. We looked at that, what regression could look like when we looked at the dermoscopic findings or features of basal cell carcinoma. We found that you could also have some regression structures from destructive, processes in these cancerous lesions. We could have a blue-whitish veil, which we also saw that a basal cell carcinoma can as well have a blue-whitish veil, but usually it's more pronounced in melanomas. And of course, there could be ulcerations, and there could be some vascular structures. If you watch the video on basal cell carcinoma, we saw that you would have arborization, okay, branching blood vessels, which are almost not really pathognomonic, but most commonly seen in basal cell carcinomas, and you usually not see arborizing blood vessels in melanomas, especially the pigmented melanomas. We'll get to find out that there is something called the amelanotic melanomas, which are melanomas that are not dark, okay? But most melanomas are dark because it's a proliferation of melanocytes that produce the melanin pigment, which is a pigment that causes skin darkening. Looking at these photos, you can see here I've put the labels. To my left is a typical finding, of a melanoma. And this is a gross photo of a melanoma, which means an unmagnified appearance, what you would see typically on a patient's skin. You can see irregular borders, so irregular margin. You can see multiple levels of darkening of melanin pigmentation. You can see that it's black there, it's lighter there, but it's still pigmented. And you can see variegated levels of pigmentation. You can see irregular borders. This is highly suspicious of a melanoma, of a malignant skin lesion. To my right is a benign melanocytic nevus. Some benign melanocytic nevus are actually difficult to differentiate, because if you look at these lesions, it has some irregular margin actually. It looks really dark. But when you use a dermoscopy, when you apply a dermoscope onto this lesion, then if it's a benign melanocytic nevus, at that point you begin to see a uniform pattern of pigmentary distribution, of the pigmentary network, a uniform network. Is what we usually tell you this is a benign lesion, and a non-uniform or a random, pigmentary networking, we usually tell you that this is highly suspicious of a malignant melanoma. Looking at this photo, when you place your dermoscope on a lesion and you see something like this, obviously you begin to panic. You say, oh, this is highly suspicious of a melanoma. Why would this be more of a melanoma than a basal cell carcinoma? Because generally you can see it's a pigmented lesion, okay? You could have some pigmented basal cell carcinomas. I'm not sure. I think we had one photo in the last video on basal cell where we saw a few globules, dark globules, or clawed dark globules. in one of the basal cell carcinomas. But typically in the melanomas, you will have multiple pigmented globules and dots. You can see it's everywhere. Dark, globules and dots, all around. You can see the blue-white veil, which looks as though you've used the transparent bluish, transparent bluish bag, to place over this lesion. You can see the blue-white veil. When you see a blue-white veil on dermoscopy, it's usually an indication that it could be very likely a malignant process in that skin lesion. So on this photo, you can see irregularity, gross irregularity. You can see the dots and globules in the periphery, which suggests active proliferation, which suggests that the melanocytes are actively proliferating. That's what this tells you. Okay, so this is highly suspicious of a melanoma. You can see some whitey streaks, which are regression structures, which suggest some destructive process and fibrosis going on. These are the things that will begin to make you think that, oh, I should be excising or referring this patient urgently to the dermatologists for an excision biopsy, which will both be diagnostic and curative. Looking at this photo, you can see this is fairly symmetrical, but you can see active proliferation. Depending on the age, if you see this kind of lesion in a young person, then it could tell you that it could actually pass for a benign melanocytic nevus in a young person. The person is still growing, there's still active proliferation. You can see the dots and globules in the periphery because it looks fairly symmetrical. But this is a middle age or elderly patient and is highly suspicious of a melanoma, especially looking at there's presence of blue-white veil. So this is actually highly suspicious of a melanoma. You can see globules, dots and globules. You can see the blue-white veil. It looks like a blue leather or blue nylon, or a blue film. And that's the best way. A blue film has been placed over this lesion. So when you see things like this, some people might say, oh, it could be a compound, benign compound nevus, but I think it's highly suspicious. You need to excise this kind of lesion to confirm the histological diagnosis. This, even without histology, is highly suspicious of a malignant lesion. If the presence of blue-white veil, like it looks like a blue veil has been placed over most of this, over three-quarters of this lesion, or 2/3 of the lesion. You can see irregular pigmentation, irregular pigmentary patterns. You can see here it's highly pigmented. The rest is this is possy-pigmented. This is highly pigmented. You can see blue-white veil, irregular pattern, grossly irregular. You can see these pigmentary streaks at the periphery, suggestive of active proliferation. You can imagine the cancer spreading, outwardly, expanding. Highly suspicious for a malignant process, irregular pigment network. You can see it's an irregular pigment network. Highly suspicious of a melanoma or malignant melanoma. You can't really see streak. There's a blue-white veil there. So by the time you place your dermoscope, you're seeing bluish hue. It's not like dark blue, but once you start getting the bluish hue, like the sense of blue light flashing on your lesion, casting on your lesion, you're like, oh, okay, maybe something malignant is going on. This is typically irregular. You can see the pigmentary network. You can see different layers or different levels of pigmentation. This is highly pigmented. This is possy-pigmented. You can see some streaks, peripheral. You can see some whitish, fibrotic, regression going on there. Okay, regression. You can see regression, these whitish streaks within this lesion. Regression tells you there's destruction of melanocytes and fibrosis going on. That's what regression usually gives you a clue that there's some destructive process going on. You can see different irregular pigmentary network. You can see here it looks much more pigmented, possy-pigmented, or and highly suspicious lesion for a malignant melanoma. This is a nodular melanoma. What it means is that a melanoma could be flat, okay, and a melanoma could be raised. And when it's raised, that's what's described as a nodular melanoma. Okay, so the fact the lesion is raised doesn't mean it's not a melanoma. It could be a nodular melanoma. okay, especially when it's pigmented. It could also be a nodular amelanotic melanoma, which means it's a proliferative malignant proliferation of melanocytes without increased deposition or production of melanin. That's what's amelanotic melanoma. But this is a nodular melanoma. You only know it's nodular when you look at it grossly because it will be raised, and you're like, oh yeah, it's a nodular melanoma. You can see irregular, you can see pigmentations, irregular. You can see the blue-white veil. You can see whitey streaks, areas of regression, fibrosis, active cancer, destruction of normal cell tissues going on. So highly suspicious lesion. And most of these photos were called from, some were called from DemNet. So giving credits, of course, these are not photos that were taken from any of my patients. They were snipped from either DemNet or just generally from the internet, snipped photos to do this video or this demonstration. So if you have a look there, you can see, this is a melanoma. Or first of all, how do we approach this lesion? You look at it grossly first of all. And you place your Dermoscope on it, and you're like, okay, you can see sometimes could be difficult, but there's regression. You can see areas of regression, varied levels of what I would call pigmentation. Look at the surrounding skin is light, so this is a Caucasian skin. Look at the surrounding skin, and then you can see irregular margin of the lesion. Okay, this looks more of an erythematous lesion than a pigmented lesion, where you can see areas of regression, whitish areas that demonstrate that there's some destruction or destructive process and fibrosis going on. So cancer cells are destructive, so they will destroy the normal melanocytes or normal skin cells, and there will be fibrosis. Okay, to replace that vacuum, tissue vacuum will be replaced by healing and fibrosis. So you can see areas of regression, white streaks there. This will tell you that, oh, of course, coupled with the history, the patient usually typically tell you that this lesion, it's a new lesion. You notice it within the last couple of weeks to a few months, and the lesion is rapidly growing, or changing in appearance, and you'll be like, oh yeah, there's likely a malignant process going on. You have to refer urgently for this lesion to be excised, which will both be diagnostic and potentially curative. So we've come to the end of this very short video that demonstrates the dermoscopic features of a melanoma. Okay, just to summarize, you can see asymmetry, different levels of different hues, levels of pigmentation, presence of dots and globules, especially in the periphery, which suggests active proliferation, of melanocytes. You can see the blue-white veil. There could be regression, areas of regression, which are white areas that suggest usually centrally, okay, because as the cancer grows and spreads outwardly, at the periphery, and as it's doing that, you can have, cut off of blood vessels, active tissue destruction from the cancer cells within the central area. So the areas of regression are usually more in the middle or center of the lesion, and generally asymmetrical lesion, highly suspicious of a melanoma. You need to refer urgently for an excision biopsy, which is usually confirmatory in terms of tissue histological diagnosis, and potentially could be curative if the lesion has been detected before metastasis has happened. If this video has been useful, kindly like this video, share, and subscribe to my channel, as more videos would be produced very shortly. Thank you for your audience.